So basically, orthodontics helps in multiple ways. Number one, function. It aligns your jaws. It makes sure that both of your jaws are in harmony so that you don't strain them. Secondly, aesthetics, as I said, it improves your smile, it boosts your confidence. Braces are to be done only on permanent teeth because when your middle tooth falls, it's only the crown that falls off. So if you apply any pressure on that tooth, it's going to fall off any which way, so it doesn't make any difference. So every aligner is to be worn for at least 15 to 20 days. Okay, so in 1 month, you will have two sets of aligners.
Okay.
Now, when I say sets, it is both upper and lower. The time duration for aligners, they depend from case to case.
Okay.
Okay, so for some cases can take around 10 aligner per arch. When it comes to choosing between aligners and or braces, so the very first factor is we see what is the severity of the malalignment the patient has. Okay, if it is too severe, then we can either do only braces, only aligners, or we can do a little of both.
Okay.
And then finish off the treatment. Then in very minor corrections, you can definitely go ahead with aligners. And again, one important factor is the patient compliance. Aligners have to be worn for 20 to 22 hours per day. Then only you will get good results with aligners.
Hello and welcome to Health Unplugged, our superstars, where we bring you inspiring conversation with leading doctors and simplify healthcare for us. I am your host Deena from One Health Assist, your daily healthcare partner. So today we are going to talk about something that we all experience on a daily basis and we hear a lot of terms: orthodontics, braces, aligners, teeth whitening, teeth straightening. So to clear all our doubts on what are all these different terms and how a patient can be treated, to break this down, we have with us Dr. Janvi, orthodontist with more than 10 years of experience. So welcome to our podcast, doctor.
Thank you.
So let's start from the beginning. Doctor, what we want to know first is what is orthodontics and what are the different terms that are used?
So, orthodontics is basically that branch of dentistry which first of all helps in diagnosing, preventing, and treating whatever irregularities are there in the teeth and the jaw.
Okay.
So, it helps with treating all the jaw deformities, your malaligned teeth, your spacing in the teeth, all of those things. uh, in other words, orthodontics can also, like for a layman person, like taro ka treatment, दांत
Okay.
सीधा करने का treatment, that is how they say. Otherwise, there is no other such other word for orthodontics,
Okay.
and it majorly helps in improving your smile.
So, as we just heard about orthodontics, next we want to know is how the patient get treated.
For orthodontics.
Yes.
So basically, orthodontics helps in multiple ways. Number one, function. It improves your function. It aligns your jaws. It makes sure that all your entire both of your jaws are in harmony, so that you don't strain them. Secondly, aesthetics, as I said, it improves your smile. It boosts your confidence. And the third aspect, it helps in making sure that there is no irregular wear and tear of your teeth, your
Okay.
gums. Basically, it helps to keep your entire jaw, teeth in a healthy condition.
Condition, correct. Okay. So, Dr. Janvi, when we hear about orthodontics, people usually think that it's about braces. So, is it that true?
Well, orthodontics is not just really about braces. There are many modalities to it.
Okay.
You have braces, then you have something called aligners, which is a very new thing. Then there are also for kids there are jaw modification appliances,
Okay.
what you call as myofunctional appliances, and then in addition to that you have retainers, which is basically an appliance that is given to a patient to after the treatment to make sure that whatever treatment has been done doesn't relapse back.
Okay.
Right? So that is the most important appliance basically given to a patient after all the entire treatment is done.
Done. So, in continuation to the discussion we just had, what is the ideal age to start the treatment for braces?
So ideally for a child, the very first orthodontic checkup, if you consider only orthodontics, the very first orthodontic checkup should be done by the age of 7. So even if the treatment doesn't begin around at that age, there are some treatments that can begin whenever we feel that there is a need in the modification of the jaw, so that it, basically what we call it as redirection of growth. So if that is needed, that can be done around that time. If not, then we usually wait for all the permanent teeth to erupt, that is come in the mouth, and then we can go ahead with the treatment that is required for that particular child. But also, let me tell you that orthodontics is not just limited to children. Even adults can get orthodontic treatment done, braces, aligners, or anything.
So it's not age specific.
It's not age specific, though. Whenever you plan on treating an adult, you have to be sure that you take into consideration the other factors as well, which is more important. The the oldest patient that I have treated is a 56-year-old male,
Wow.
so it can be possible.
So that is to boost the confidence and
Yes,
have
yes,
a good smile, basically.
yes.
Correct?
Again, not just smile, the stability of the
Jaw.
jaw, the how your jaw aligns, your bite, probably
It
even,
affects.
yes, it affects a lot.
Okay.
It helps a lot in that.
Correct.
Braces are to be done only on permanent teeth because, see, I don't know if you realized. So when a milk tooth falls off, it is just the crown.
Correct.
Okay, so your tooth, first of all, is crown and root. So in your gums or in your jaw, you have the crown which is visible, and then in the bone, you have your root. Okay, so when your milk tooth falls, it's only the crown that falls off. So if you apply any pressure on that tooth, it's going to fall off any which way. So it doesn't make any difference.
So ideally, it should be done once
On,
all the milk.
yeah, ideally, yes, on the permanent teeth.
So let's move to the next segment. So what are the different types of appliances that you use for braces?
So braces, first, it's is the very first and the basic appliance that is used in
Okay.
orthodontic treatment. Then, as I mentioned, for kids, you have myofunctional appliances which help in the modification of the jaws. Then you have aligners again. Then which are majorly used for minor corrections.
Let's talk now specifically about braces. So, ma'am, what are the different types of braces available in the market?
Okay, so you can categorize them into two, three types.
Okay.
First is the conventional braces. Um, in that also you have two different types. Again, it's dependent on how they are made and with what composition they are made.
Okay.
So first you have the metal braces, which is very, very common. The metal
Yeah.
braces you must be
Yeah.
knowing. Then you have the ceramic ones.
Correct.
Okay, ceramic ones is basically, it is tooth colored and it is less visible. In the metal ones, it is very much visible, but it is an efficient mode of treatment. Traditional braces are the best at the moment. Then you have lingual braces. Lingual braces are basically the braces that are fixed on the inner side of your teeth,
Okay.
both upper and lower jaw.
That's
And
different.
then, yeah, and then the third type is called self-ligating braces. So now the difference between self-ligating and the conventional braces is that in conventional braces, you have to put a rubber band on the bracket to make sure that the wire is secured in the bracket. Whereas when it is concerned with self-ligating braces, you just have a clip.
Okay.
It's like a door. You just have to put the clip and the door closes and the wire is secured. So that is more useful in reducing your chair side time and reducing your frequent visits to the doctor. Again, self-ligating braces are more advised in, say, teenagers, or growing kids, in whom you don't want to remove any teeth, but you want to get good results.
Okay.
So that would be like a preference for kids of those age groups.
So that will be more even comfortable for the
Yes,
kids.
yes. So
Yeah.
self-ligating braces, because of the technology and everything, they are actually much smaller in sizes as compared to the conventional metal braces.
Correct.
So they are more, say, patient friendly. They're more easy to use. They're more efficient in, moving your teeth.
Okay. So which type of braces works best in what kind of patients or cases?
So, in cases which are quite severe and have a major malalignment problem or severe crowding, is what we
Hmm.
say, normal metal braces or self-ligating braces, they do wonders.
Okay.
Okay, and if you have like if the patient is very much concerned about his looks, or the braces will be visible, so you can give them the ceramic options.
Okay.
And if they are too concerned about their looks that they don't even want the ceramic ones to
To
be
be
seen,
seen.
then you can give them the lingual option, the one that goes from the
Inner
inside.
side.
And then so on and so forth, then you have those options. If you
Okay.
don't want anything in your mouth, then you can give aligners, which you can remove while eating and brushing, and you can wear them back again.
Okay. So now we know that there are different types of braces that can be used. So what is the average treatment time for braces, ma'am?
So on an average, uh, an orthodontic treatment or braces treatment take around 1.5 to 2 years.
Okay.
That is when the patient is compliant, following all the restrictions, brushing properly, everything. Now, what happens is, I'm just going to give you an example with how you drive a car. So what usually all orthodontists do, you know, so that process is called bonding.
Correct.
They bond all the brackets, either one jaw or both of them together. Now, so when you start driving a car, right? You have a free road. You're driving. You go from first gear to second
Second.
gear, second to third, third to fourth, and fourth to fifth. Fifth is the topmost,
Right.
where you're going smoothly.
Hmm.
Okay. So now, when it comes to braces, you have no breakages. Everything is going on very smoothly. You are on the top-notch speed of your treatment. Now, whenever a bracket breaks, those are called brackets. Whenever a bracket breaks, what do you do when you have a speed breaker? You have to come down, right? You
Right.
have to come on the second gear, right?
Huh.
So now imagine you're in the fifth month of your treatment. You are on, say, the fifth wire of the treatment.
Okay.
So every month, the wires that we put in the patient's mouth, they also change depending on how the teeth have aligned.
Aligned.
So now, say you're on the fifth wire, a bracket broke. Now, whatever treatment was done on that particular tooth goes from 5 to 0.
Zero.
So then what
Okay.
happens? You have lost 5 months, like from 0 to 5, you're coming back to 0.
Zero.
So
Okay.
you've lost 5 months of your treatment. So your average treatment time is 1.5 to 2 years if you don't break brackets. If you break brackets, then you have to count, keep on adding like a month or
More
two
months.
to it.
Yeah.
So then that goes on to 4 5 years. That is again dependent on the patient.
So doctor, how are braces different from aligners?
So as I mentioned the word bonding earlier, so brackets are bonded on their teeth with the
Correct.
help of a cement called composite. So since they are fixed on your teeth, they exert a continuous pressure.
Right.
Whereas when it comes to aligners, uh, the pressure is not continuous. Okay, it's a very intermittent pressure,
Hmm.
or a pressure that you have on your teeth. So when you place your aligners, the pressure is continuous. But the moment you remove your aligners, from 100, it goes to 0.
Okay.
Okay, so then that is not continuous pressure. So this is the difference between braces and aligners. Now, aligners are totally patient compliant,
Okay.
whereas braces, you have everything fixed, so that is not but you do need patient compliance. But when it comes to uh, following the restrictions that you have when it comes to eating, so you're not supposed to eat anything hard, crunchy, sticky, hard to bite, like peanut, no sticky food like marshmallows or the sticky chocolates, those caramel toffees. All of this has to be
That is why the
followed.
kids don't like braces.
Exactly. Especially there are some kids who love pani puris, so I'm sorry, you cannot eat that. Then, and the other aspect is brushing. Now, the reason why I want to emphasize on brushing, what happens is if you don't maintain your hygiene properly, you are more susceptible to having cavities. So, which is again not a good thing.
Okay.
So, that is why you have to take care when it comes to braces. Everything has its pros and cons. So,
Okay.
that's how it is.
So doctor, can you please help us understand aligners in a better way?
Sure. So aligners are nearly invisible custom made trays for every patient. They gradually push your teeth into position with the help of certain modalities that are to be done with aligners. Again, so as I mentioned, aligners are very patient compliant. On how aligners are made, so basically you have to take a scan, a 3D intraoral scan is to be done first. Then that scan is uploaded on a software.
Okay.
On that software, then your entire treatment is planned, and then according to how your treatment is going to go ahead or how it is planned, then you get your aligners depending
Okay.
on that. Now when it comes to the time duration for aligners, they depend from case to case.
Okay.
Okay, so for some cases you can say it can take around 10 aligner per arch,
Okay.
which is 10 upper 10 lower. Okay, or there are some cases which even go to 96 and 100 and above
So
per
this is
arch.
case specific,
Yes, it
basically.
is very case specific. It is it's not one size fits all.
Okay.
Okay, in braces it is one braces fits
Yeah.
all, but again in braces also there are some mechanics that needs to be
Correct.
incorporated in the wires,
Hmm.
but not everyone needs those.
Right.
So that way that is how it works.
Okay.
So every aligner is to be worn for at least 15 to 20 days. Okay, so in 1 month you will have two sets of aligners.
Okay.
Now when I say sets, it is both
Up
upper
and
and lower. Okay, it
right.
is not just one.
Hmm. So, as you just mentioned, there are so many technicalities that are related to dental treatment or to aligners. What I want to know here is how do you decide एक patient को aligners लगेंगे या braces लगेंगे?
So when it comes to choosing between aligners and or braces, so the very first factor is we see what is the severity of the malalignment the patient has.
Okay.
Okay, if it is too severe, then we can either do only braces, only aligners, or we can do a little of both
Okay.
and then finish off the treatment. Okay, then in very minor corrections you can definitely go ahead with aligners. And again, one important factor is the patient compliance. Aligners have to be worn for 20 to 22 hours per day, then only you will get good results with
So
aligners.
even when the patient when they're sleeping, they have to be
Yes, they have to wear it while they're sleeping. So if you break down the 22 hours and you have four major meals in a day, right?
right.
So four major meals in a day adds up to 2 hours.
Right.
So 22 hours. That's how you're supposed to wear it.
Okay. So it's a compulsion that it
Yes,
has to be on all the
yes,
time.
yes.
Okay.
It has to be there. Otherwise, if you're not being able to wear it for the given amount of time, so instead of the hours, your days
Will
get,
extend.
yes.
Okay.
So then instead of 15 to 20 days, probably you'll have to wear one aligner for 25 days or 30 days. Because the way your teeth have to be in a position for the next aligner to be in your mouth, it has to be properly in that position.
Okay.
Then only, say for example, set number 2 you haven't worn for your given amount of time, and then you switch on to set number 3 directly after 20 days, but you know your set number 3 is not fitting, so you have to go back to set number 2. सो दिस इज व्हाट वी कॉल एज राउंड ट्रिपिंग, कि वापस
Okay.
घूम के वहीं पे
वहीं पे
आना
आना
होता
है.
है. सो दैट्स व्हाई यू हैव टू यूज 22 hours. If the patient is saying that कि मुझसे 22 घंटा नहीं होगा, then you straight away give the patient the option of braces. You
Okay.
want to save you and the
It's
patient
like
both the have.
compulsorily you have to wear it.
मतलब ये नहीं करना है तो ये तो करना ही पड़ेगा. You have no option.
Okay. So as you just mentioned about patient compliance, so how important is a follow-up to be done in a patient, and what do you or how do you see platform like One Health Assist helping a doctor and a patient?
So for braces treatment, there has to be a monthly follow up. Like there is nothing you can do about it. You
Okay.
have to be there for a monthly follow up, because you, if you remember me giving an example of driving a car and a
Correct.
broken bracket. So if the relapse of that particular broken tooth is not too severe, then you can actually save the treatment from going to 5 to 0. You
Right.
can actually catch it midway. But if you don't follow up after a month, then probably the severity would be more as compared to what you wouldn't have if you do a monthly follow up.
Correct.
And as far as liners are concerned, I think that also a monthly or a bi-monthly follow up is required. But if the patient is traveling, you have to make sure that you tell the patient to send pictures of them wearing the aligners when they change to every new set. That would actually help us in making sure that the treatment is tracking well
Okay.
that way.
So as you just heard about the follow-ups here, what I want to mention is platform like One Health Assist is definitely going to help you first to book a consultation for a patient, to set reminder for follow-ups, and even book appointments or a follow-up appointment with a doctor. So ma'am, can you share a patient story which made you feel that patient is actually happy or transformation hua hai?
Yeah, so this patient was one of the cases that I did during my post graduation days. An 8th standard kid whose mother actually dragged him along. कि चलो चलो जाके दिखाते हैं करके. And so he had just one issue. He had one tooth between the front two teeth,
Okay.
because of which he was very shy, while smiling, because that one tooth made his teeth a little malaligned. So we put the braces, we bonded the braces, we got that tooth removed, we put the wire and recalled him after a month. And the changes he had, they were amazing.
Okay.
Like his mother actually said, he actually smiles now. So that's one inspiring thing.
So that's pretty nice to know that this kind of treatment can help a patient or a child to build more confidence and
Yes,
smile happily.
happily, yes.
Yeah, that's nice. So what inspired you to take dentistry as a profession?
I always felt that, when people smile, you can actually uh, get to know what kind of a person they are. So I was always inspired by people's smiles.
Okay.
And also when I was in my third year of graduation, I myself got my braces done. So I mean, even though it was something very minor, but I really wanted to get it done, and that actually helped me, like, get confident while smiling. And then that was my inspiration, that I also want to give people good smile.
So in continuation, doctor, can you tell me now that how did your journey as a dentist started after what inspired you to become a dentist?
As I said, I was really into, wanting to give people their
Good
smiles and
smile.
making them pain free. So my BDS, my graduation journey started in 2009, and in that 5 year course, in my third year, I got my braces. And one more patient story I would like to share is that in my internship, so in BDS during graduation, we have to do all everything that is to be done in general dentistry, like root
Correct.
canal and fillings and cleaning and everything. I had this one particular auntie, and not just one, but a couple of them. When I finished the root canals, they came and they said to me, like, thank you so much. This pain was really bad. Thank you for treating. Your hand is so light. All of that.
It
And that
feels good
actually,
to know,
yeah,
right?
it was really good. So that inspired me to become better.
Okay.
And then, as I said, in the third year, I got my braces done. So I was, more inclined towards orthodontics, because that is how you act. And that's actually, you feel so good looking at the changes, I'll tell you. I mean, I've been treating patients since 2017 with braces.
Okay.
And the changes that I see in a patient, that particular smile that I want in a person, and I get that, it is so satisfying to another level. I really can't tell you about that.
So that transformation really makes you and the
Yeah,
patient both
it
happy.
makes me more happy than the patient. I mean, even if the patient will be like thoda idhar thoda udhar, but listen, this is good enough, and it's really looking good on you. And
Okay.
it obviously boosts the patient's confidence,
Confidence,
and gives them that smile and
satisfaction.
satisfaction,
Yeah.
everything. So I really like that.
Okay. So now let's bust some myths that braces are only for children.
No, not at all. As I mentioned earlier, that my oldest or eldest patient that I had treated was a 56-year-old male. So that doesn't mean that braces are only for children. Yes, when it comes to adults, you do have to take other things into consideration as well. But
So,
it can be done.
so what I've commonly heard is braces are really very painful. Is that true?
No, no.
Okay,
You may have slight discomfort in the initial 2 days, but everything is fine.
it's not
It's not
painful.
painful.
So once the treatment is completed, does the result last forever?
No,
Okay,
you need to wear retainers compulsorily for a year to make sure that the changes that we've achieved, they stay put, like they stay wherever they are.
okay.
Okay, so you need to wear retainers for, like, I usually advise the patients to wear it for a year. And if you want, nighttime you can continue wearing for your entire life, because relapse is like a nightmare for an orthodontist.
Okay.
So we fear that one word and that entire process.
So
So if
to
they,
stop a relapse,
you have to wear
retainers have to be worn.
retainers.
Okay.
Yes.
So as you know that a lot of free information is available on internet. So is it safe to just take the information from internet and do a self-diagnosis, or a consult is very important?
No, no. A consult is very, very, very important. You cannot self-diagnose. Please do not Google or YouTube anything.
Okay.
You have to go to the concerned specialist and get yourself diagnosed properly, and that is only the way you can get proper results with whatever treatment you want. I mean, there are certain things. I mean, it's very common. You search for stomach pain, bolenge you are stage 4 cancer, and you're
Right.
about to die.
Die. It's
So,
fatal.
yeah, so jokes apart, you need to go to a specialist for whatever concerns you have and get it treated accordingly.
So don't rely on the information that is available on internet freely. Consult your doctor and get treated in a customized way. And you can book your consultation on One Health Assist. So orthodontics treatment require a lot of reminders and follow-ups. So how do you see a platform like One Health Assist helping you as a doctor?
So One Health Assist is of a great help, to be very honest. Like, I've personally seen how the software works. Patients can definitely use it to book appointments and store their photos, their pre-X-rays. So when they're done with the treatment, we can compare with the photos and
Correct.
X-rays, set reminders whenever you have to come, and everything like that. So it's a good tool for the patients also, to make sure that the treatment is going on smoothly and efficiently.
So, viewers, you can use the health repository feature on our One Health Assist app, where you can store all your lab reports, your x rays, your before after pictures of the treatment, and you can even set reminders for your appointment, or a pill reminder is also possible. You can even book your lab test and get the services at doorstep, and even medical subscription can be done, and you can call for medicines at your doorstep. So, please avail this facility on One Health Assist. So, Dr. Janvi, thank you so much for all the insights on different types of braces or aligners, or how a patient can be treated. So, it was really very insightful for you to tell us all the details and to clear the myths and doubts.
Thank you so much.
So, to our listeners, orthodontics is not just about a perfect smile, it is about building a long term confidence, about a good treatment. And to consult a doctor, we have Dr. Janvi on our portal. So, please book a consultation and get treated in a customized way. So, this has been Health Unplugged, a superstar, signing off for now. Until next time, please like, share, and subscribe, and keep smiling and keep health on top of your plan.